With me now is Dr. Ian Bullock, who is Chief Executive of the Royal College of Physicians. Hello to you.
Hello.
Now, what do you consider to be the role of the Royal College of Physicians in 2017 and beyond?
I think it's got a crucial part to play within the community of physicians. So it's about providing a relevant voice, bringing people together to be part of the solutions that we're facing at a social level, at a society level, in terms of the challenges around health. But it's also got an important role to play as a leader and as a leading medical voice. And as a challenge to government and policy, and to connect those things together to try and ensure that we optimise what the experience of care is for the patient.
And do you think that it has a real impact on the profession, and what is that?
I do think it has a real impact, and that is from board level right down to leading clinical teams at a ward level. And I think from our history and certainly from the way that we engage, we have strategies that go into each of those areas, and each are equally important to influence top-down decision making as well as supporting clinicians in ward-based environment.
Now, you yourself started out as a nurse.
Yeah.
And what sort of role do you think that the Royal College of Physicians can play for non-physicians?
I was really pleased when we articulated that in the 5-year strategy, and that is that physicians can be leaders of the multidisciplinary team. So I think they're part of the solution, the way that they can be glue that bring the different professions together in the ward context or in any clinical context. And we've also reached into supporting the development of new workforce solutions like the physician associate faculty, which again is an extension to our influence.
And you mentioned the physician associates. How important is it to draw in non-physicians to the work that the Royal College does?
I think it's incredibly important to continue to be relevant. You know, we're not 499 years old by accident. So we've had to continually reinvent ourselves in terms of being modern and relevant, and I think that that's equally important. So I would say the non-medical professions, yes, but also members of the public, lay people, in the way that they shape some of our guidance and interpret the evidence work that we do.
So you hinted there, it's the 500th anniversary next year. Yeah. What do you see as the role sort of going forward?
I think it's to learn the lessons from the past, but more importantly, it's to demonstrate that we have a relevance to the modern workforce. So particularly to trainees who've been through a really tough time around contract negotiations, and to understand how we add value as a professional body, and we're seen as the go-to for them, but also as a go-to solution for healthcare. So some of the things that we want to be doing is developing consultancy support, outreach, improvement type activity to really be part of the solution facing the NHS at an important time.
So always developing and moving forward.
Absolutely, and we have an amazing staff team that is supported by officers and senior officers that enable us to do that. And my job is to try and ensure that we reach as many of the membership and fellowship as possible.
All right, well, good luck with that, Dr. Bullock. Thank you very much.
Thanks very much.